Good morning, everyone. By virtue of the authority conferred upon me, I constitute this assembly a congregation of the University of Cape Town.
Good morning once again, ladies and gentlemen. At this moment, I would like us to invite us to sing the national anthem. Thank you very much, ladies and gentlemen. While you remain standing, allow me at this moment, Chancellor, I have the honor to invite a member of the SRC to read the university dedication.
Greetings, everyone. My name is Jeffrey Mukwena, and I'm the SRC Vice President for 2023-2024. Before I begin, I'd like to acknowledge the presence of the Chancellor of the University of Cape Town, Umama, called Mumama. I'd like to also acknowledge the presence of the incumbent Vice Chancellor of the University of Cape Town, Prof. Mosama Shabela. I'd like to also acknowledge the presence of the DVC of Transformation and Student Affairs, Prof. Elolwani Ramokondo. I'd like to also acknowledge the presence of the Dean of Health Science, Prof. Lionel Green Thompson. I'd like to also, hey, today we have a lot of deans here in this room, to acknowledge the presence of the Dean of EPE, Prof. Alison Lewis, and acknowledge the presence, most important, of parents who are here, and also acknowledge the presence of our graduate. And I've been tasked with something very simple, and it is to read the university declaration, by the way. At this time of celebration, we, the members of the University of Cape Town, reaffirm our mission to nurture rational and creative thought and free inquiry, to strive for excellence in teaching and research, to educate for life, and to address the challenges of our society. We undertake to advance these ideals in a spirit of freedom and responsibility, and through consultation and debate. We celebrate our founders, benefactors, and predecessors, those who have built the fabric and nourished the values of UCT. To those of you who will graduate today, we wish you courage, wisdom, and purpose. To those who will leave the university to learn and work elsewhere, may you be sustained by those values which unite us here today and advance them in the world beyond. A love of truth, and of learning and of our university. Thank you very much.
Thank you very much, Deputy President. Ladies and gentlemen, you may now be seated. Good morning once again. Ladies and gentlemen, esteemed guests, colleagues, students, graduates, families, and friends, it is my distinct honor to welcome you to the University of Cape Town's graduation ceremony for the Faculty of Health Sciences. Today, we are going to celebrate the remarkable achievements of 317 graduates, including 62 outstanding PhD candidates, the highest number of PhD graduates that we are going to have in this September ceremony of the 7 ceremonies we are having this week. Their contributions, of course, to research and innovation will be crucial in advancing the health and well-being of our people locally and globally. This is a day of great pride for us and celebration for everyone else who is here. Whether you are supporting a loved one or you are part of our academic community, your presence makes this moment very meaningful for all of us. Together, this morning, let us honor the hard work, the determination, and the excellence that have led our graduates to this very significant milestone in their careers. I now want to call our soothing voices from the College of Music to render a special item in honor of our graduates, your families, and the academic procession. We are delighted this morning to invite soprano Setswana Ntseki to perform for us today.
Mama is a queen and Papa is a king, so I am a princess and I know it. But court etiquette is a dull, dreary thing. I just hate it all and I show it. To sing on the stage, that's the one life for me. My figure's just like Kim Kardashian. I know I'd win fame if I sang in Bohème, that opera by Signor Puccini. Okay. Avrolans and the trills that would send the court frills down the backs of the heroes of my vocal frills. I long to be a prima donna, donna, donna. I long to shine upon the stage. I have the embonpoint to become a queen of song, and my figure will look pretty as a page. I long to be the screechy, peachy, cantatrici, like other plum girls that I've seen. I hate society, I hate propriety. Art is calling for me. I'm in the elite and men sigh at my feet. Still I do not fancy my position. I have not much use for the men that I meet. I quite sensation. Those tenors so sweet, if they made love to me, I'd be a success that I do know. And maybe I'd also if I won't sing in Faust, that opera so charming by girls would be on the brink of hysterics, I think. Even strong men will have to go out for a drink. I long to be a prima donna, donna, donna. I long to shine upon the stage with my avoirdupois and my tra-la-la-la-la. I would be the chief sensation of the age. I long to hear them shouting, "Viva to the diva!" Oh, very lovely that will be. That's what I'm dying for. That's what I'm sighing for. Art is calling for me.
Well, need I say anything further? Let me introduce you to them. So here at UCT, we have the College of Music. The vibrant South African College of Music is considered to be a rare gem, offering diverse range of genres of music from African and world music, classical, jazz, music technology, and opera with exceptional standards of pedagogy, research, and performance. The Prelude music and the national anthem were accompanied by Dr. Lisa Engelbrecht. Raise your hand, let them see you. Lisa, there you go. Dr. Lisa Engelbrecht is a pianist, a vocal coach at the Opera UCT. She obtained her doctorate in music and collaborative performance through UCT. She performs regularly as a vocal accompanist in South Africa and abroad, and is a member of the teaching faculty at the International Lyric Academy Summer Program in Vicenza, Italy, and is a guest vocal coach at both the Royal Academy and the Royal Colleges of Music in London. Marimba Jam. Let them see you. It's an award-winning social enterprise that both performs and teaches the African marimbas in Cape Town and Johannesburg. The company originally sprang from an outreach initiative created in 2012 to share the joy of playing marimbas with learners from underprivileged schools. This initiative aimed to give learners a means of expression through rhythm and music and promote cultural and social harmony. Now, Marimba Jam is a thriving company that continues to enrich students with the energy and enjoyment of marimba music, while our non-profit organization branch reaches out to vulnerable communities. Our professional performing marimba band, which includes members who are currently completing their degrees at the University of Cape Town, has over 10 years of experience performing at a wide range of events, from corporate conferences to weddings. The director of Marimba Jam is also a proud UCT graduate, bringing a strong academic background to our leadership. With over 500 students taught weekly and a professional performing band, Marimba Jam has become a dynamic and growing organization. For what we have just been served and treated to, pianist Dr. Lisa Engelbrecht accompanied soprano Setswana Ntseki, who sang "Art is Calling for Me" from The Enchantress. Setswana Ntseki is a soprano from Botshabelo in the Free State, currently completing her Master's in Music degree here at the University of Cape Town. During her studies, Setswana was awarded first prize in the Fine Music Radio Bursary Awards competition, as well as the first prize for the David Aldred Memorial Prize for Sopranos. In 2023, she performed leading roles as Isabella in Lingano Felice at Artscape Theatre and Stella in Opera UCT's The Tales of Hoffman at the Baxter Theatre here at UCT. I mean, how can I not be proud? Thank you very much. I will now invite the orator.
Chancellor, I have the honor to present for the award of the degree of Doctor of Science, honoris causa, Deborah Bradshaw. You might know Florence Nightingale as the lady with the lamp, caring and compassionate, the founder of modern nursing. What is less well known is that Florence was in fact a pioneering biostatistician. When she went to nurse in the Crimean War in the mid-1800s, she was appalled by the conditions in military hospitals. Medicines were in short supply, there was no clean linen, there were swarms of bugs, lice, and fleas, and rats were cavorting under the beds. She began collecting data. Her meticulous records and use of statistics allowed her to show that 10 times more soldiers were dying of typhoid, cholera, and dysentery, in other words, unsanitary conditions, rather than from battle wounds. More importantly, Florence understood politics. She recognized that complex data needed to be presented in a way which made it easy to understand, especially for politicians. She used her visual data analysis to persuade the British government to implement better ventilation, improved sanitation, and improved nutrition in hospitals. These reforms drastically reduced mortality rates and set new standards for healthcare. On a modern scale, Debbie Bradshaw, biostatistician, epidemiologist, and activist, has collected data, presented hard evidence, influenced politicians and policy, and impacted the lives and health of many hundreds of thousands of South Africans. For example, in the 1990s, in the middle of the garlic, beetroot, and African potato years of AIDS denialism, Bradshaw and colleagues set about collecting evidence linking HIV/AIDS to mortality. This involved systematically collecting and analyzing data from official death notifications. They showed that the demographics of those dying matched the profiles of those testing positive for HIV and matched the geographical spread of the disease. The initial report on their findings was downloaded more than 20,000 times in the first few years. Debbie Bradshaw also understands politics, and this work was pivotal in getting the government to roll out antiretroviral treatment. There are many, many other examples of her important work in exposing what is known as the burden of disease. She has led the deep dive into studies showing the impact of chronic diseases on mortality, the need for better data on infant deaths, the effectiveness of primary care of diabetes, the mis- and underreporting of deaths due to HIV/AIDS, and how apartheid inequalities still persist in the health system. In summary, Her lifelong work in collecting and analyzing data on causes of death and disease paint a starkly clear picture of our health challenges. This picture is what has persuaded government to put resources where they are needed most. Her work is a kind of imaginative reach, the ability to foreground the previously unrevealed, and it takes effort, courage, and extreme diplomacy skills, all of which Bradshaw has in excess. Her expertise is recognized and sought after nationally and internationally. She has served on multiple governmental advisory committees and has participated in numerous expert consultations to the World Health Organization. During COVID, she co-chaired the WHO Technical Advisory Group on COVID-19 mortality assessment. It seems obvious now that bugs, lice, fleas, and rats lead to disease, but in the Crimean War, it was not. Debbie Bradshaw's ability and skills in revealing the stuff you don't see, her political acumen, and her moral courage have had a profound impact on public health in South Africa and beyond. Chancellor, I have the honor to present, for the award of the degree of Doctor of Science, honoris causa, Deborah Bradshaw.
To you all of great minds, we say congratulations. Now rise above, for you have received your wings today. Do not be late. It may result in defeat. Be always in time to meet the arising occasion. Ewe ikibe yadinwa yonke into madoda, ngoba kaloku inyembezi besikwazi unqumlisa umbombo, ngoba lento imfundo ifuna iqhoshe ngenamntunja, kodwa namhlanje ehleka nelogqibela, ngoba lentwana uSathane idanile. Kuni baxhasi bemfundo yabo sithi huntshu umkhulu umsebenzi enuqhakathileyo. Sulane zonyembezi zekhala kaloku nilile zovuyo. Yithani ithemba mqala uzoginya ngoba uvuthiwe lomqubu kadudutyelwa. Sibamba ngazo zozibini kuni bahlonitshwa. Sithi qhubekani nibancelisa ngoba ningumthombo wemfundo apho zonke izinsana zincela khona. Your perseverance will never go unnoticed. Amade ngawetyala makwedini ugabutse washo umuntu omlambo uthi thiba umsuthu umjoba uthiko loshinozinga ephuma enyantsula esithi esenjenjeya halala 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 yo.
That was Imbongi Mam Nelisa Sampi. She's a composer and an orator of poems of praise. She offers critical commentary and narrative on the state of society through their izibongo. The poem of praise, Enumbongo, was offered today in honor of the graduates, in honor of the families, and in honor of the teachers. The praise poet for today's ceremony, Nelisa Sambi, describes herself as a vocalist, a dancer, a percussionist, and a composer who performs across multiple genres of Afropop, Afro-jazz, gospel, and South African music. She graduated from UCT. And holds an honors in education and curriculum studies. Thank you, Mama. Siyabonga.
By virtue of the authority conferred upon me, I admit to the degrees specified and grant the diplomas specified to the candidates recorded as in absentia. I shall now grant the diplomas and certificates and admit to the degrees specified the candidates to be presented to me.
Mulweni, Sanbonani, Tumelang, Goeiemorgen, good morning. A special welcome to the VC for his first health sciences graduation here at UCT. But a particular warm welcome to the staff who've come out in their numbers to support the graduates we're presenting here this morning. And sorry that I'm using the privilege of the podium, Chancellor. Chancellor, I have the honor to present candidates for diplomas and degrees. For the Higher Certificate in Disability Practice, Emihle Ruth Nchinga. Higher Certificate in Disability Practice, Samali Nabwire. For the Advanced Diploma in Cosmetic Formulation Science, Sinebongo Ketien. For the Bachelor of Medicine and the Bachelor of Surgery, Sakile Sandile Gule. For the Bachelor of Medicine and the Bachelor of Surgery, Rofiwa Mukondeleli. Ntswakeng Eva Kunutu. Christopher Yamikani Sipolo. Lungiswa Gwanya. Chepang Neo Kungwane. Nontogozo Ndlovu. Wabuti Chidzavula. Florence Mushuri Kosiame Ntini. For the Bachelor of Science in Speech Language Pathology, Siwapiwe Ovayo Mninzi. For the Bachelor of Medicine and the Bachelor of Surgery, Riabetswe Charity Mokhachane. Lwambeso Noche. For the Bachelor of Medicine and the Bachelor of Surgery, Amara Peters. Bradley Christopher Thompson. For the Bachelor of Science in Occupational Therapy, Simpiwe Prudence Nhlapo. Humbulani Rasila. Turan Strachen. For the Bachelor of Science in Audiology, Mbali Tobega Sibisi. For the Bachelor of Science in Audiology, Jody Shamanique Wright. For the Bachelor of Science in Occupational Therapy, Nakisani Moteo Nesengani. For the Bachelor of Medicine and the Bachelor of Surgery, Christopher Mark Clutie. Amal Joseph. For the Bachelor of Medicine and for the Bachelor of Surgery. Congratulations. Matthijs. For the Bachelor of Medicine and the Bachelor of Surgery, Nathan Neville Matthijs. Congratulations. For the Bachelor of Medicine and the Bachelor of Surgery, Andile Miles Ndlovu. For the Bachelor of Medicine and the Bachelor of Surgery, Riabetswe Tato Khongwane. For the Bachelor of Medicine and the Bachelor of Surgery, Karima Bolaki. For the Bachelor of Medicine and the Bachelor of Surgery, Hanan Laila Khan Kasim. For the Bachelor of Science in Speech Language Pathology, Reneilwe Chakane. For the Postgraduate Diploma in Emergency Care, Huguet Lusamba Ntumba Makolo. For the Postgraduate Diploma in TB HIV Management, Nkolisi Njabulo Ulu. For the Postgraduate Diploma in Pediatric Radiology, Dashni Govender. It's always great when there's a staff member amongst the graduates. Postgraduate Diploma in Health Professions Education with distinction, Pamela Joy Gretschel. For the Postgraduate Diploma in Palliative Medicine, Sinalo Maleho. For the Postgraduate Diploma in Palliative Medicine, Nkadu Muriel Moshe. For the Bachelor of Medical Science Honors in Biokinetics, Gabby Fisher. Thakira Mosaville. For the Master of Public Health with distinction in the dissertation, Desire Munyaradzi Kanganga. For the Master of Science in Biomedical Engineering with distinction in the dissertation, Muhammad Arshad Eyasem. For the Master of Science in Medicine with distinction, Tatenda Lavmo Vudzijena. For the Master of Science in Medicine, Babalwa Yekelo. For the Master of Science in Medicine with distinction, Zizo Lusiki. For the Master of Science in Medicine with distinction, Emmanuel Adebowale Fajemison. That's what happens when you bring your colleagues with you. For the Master of Medicine with distinction in the dissertation, Rufaro Kashangura Majirija. For the Masters of Public Health with distinction in the dissertation, Reginald Tuleni Shuya. For the Master of Public Health with distinction in the dissertation, Popo Refilwe Mercy Cheshe Mosihi. For the Master of Science in Medicine, Mbalenche Yolanda Matolo. For the Master of Medicine, for the Master of Medicine with distinction. So the Master of Medicine is the degree that specialist medical people get. So for the Master of Medicine with distinction in the dissertation, Eddie Mshava Zita. For the Master of Science in Exercise and Sports Physiology with distinction, Jamie Michael King. For the Master of Science in Exercise and Sports Physiology with distinction, Leanne Verwey. For the Master of Philosophy in Clinical Pharmacology with distinction, Jenny van Dijk. For the Master of Philosophy in Biokinetics, Natalia Francisca Ferreira. For the Master of Philosophy, Sophie Celine. For the Master of Philosophy in Biomedical Forensic Science, Sophie Celine Kamboa. For the Master of Philosophy in Disability Studies, Dureya Abrams. For the Master of Public Health with distinction, Tandogazi Mkwizana. For the Master of Science in Biomedical Engineering with distinction, Caitlin Natalie Farrell. For the Master of Science in Biomedical Engineering with distinction, Orenile Maipetlo. For the Master of Science in Biomedical Engineering with distinction in the dissertation, Kamani Makungu. For the Master of Public Health, Marian Yabrafid Edusei. For the Master of Science in Exercise and Sports Physiotherapy, Megan Claire Chetty. For the Master of Science in Medicine, Candice Kelly Mackenzie. For the Masters of Public Health, Criselda Pillay. For the Master of Science in Medicine with distinction, Jonathan Nyasha Katsukunya. For the Master of Science in Medicine with distinction, Ansuya Chetty. For the Masters in Public Health with distinction in the dissertation, Yunus Muya Chilengu. For the Master of Public Health, Philip Mbulalina Dambisia. For the Master of Philosophy in Biokinetics, with distinction in the dissertation, Anna Rebecca Malan. For the Master of Medicine, Sakina Rashid. For the Master of Science in Medicine, Bachiva Chana Brandt. For the Master of Philosophy, Suleika Abrahams. For the Master of Science in Speech Language Pathology, Nasreen Ali. For the Master of Medicine, Hamad bin Faik Hamuldin. For the Master of Medicine, Brenda Bongiwe Tiala. For the Master of Science in Medicine, Riachobaka Tichaba. For the Master of Medicine, with distinction in the dissertation, Nelson Manuel Pinto da Costa. For the Master of Medicine, with distinction in the dissertation, Mohammed Yassin Sangay. The Master of Medicine, Zakaria Al-Ashab. Tebogo Clive Shako. For the Master of Philosophy in Biomedical Forensic Science, with distinction in the coursework component, Carly Valchik. For the Master of Philosophy in Forensic Biomedical Science, with distinction, Carl Friedrich Grevel. For the Master of Science in Biomedical Engineering, Sonam Viba Maharaj. For the Master of Public Health, Sipesihle Mandisa Sitole. For the Master of Public Health, with distinction in the coursework component, Kathleen Elizabeth Bradley. For the Masters of Public Health, with distinction, Sudarshan Govender. For the Master of Public Health, Kayla Bagg. For the Masters of Science in Medicine, with distinction, Jesmika Singh. For the Master of Science in Medicine, with distinction, Luanda Abonga Buthelezi. For the Master of Science in Medicine, with distinction, Karabo Mompati Diseko. For the Master of Science in Medicine, with distinction, Valencia Masejo Chauke. For the Master of Science in Biomedical Engineering, with distinction, Brandon Herbert Rebo. The Master of Science in Medicine, with distinction, Nosipo Snenhlanhla Mabizela. For the Master of Science in Medicine, with distinction, Kuhle Mkinga. For the Master of Public Health with distinction in the dissertation, Katerina Beatrix Conradi. For the Master of Public Health with distinction in the coursework component, Amanda Adelheid Marshall. For the Master of Science in Physiotherapy, Lisa Labuskachny. So the Masters of Philosophy in a clinical discipline are what subspecialists get when they qualify. A Master of Philosophy in Pulmonology, Tariq Hassan Ahmed Zobair. For the Master of Public Health, Paidashe Chamuka. For the Master of Public Health, Natasha Roya. For the Master of Philosophy in Emergency Medicine, Matamba Jean-Benoit Kabeya. For the Master of Science in Medicine, Rowena Claire Fasahi. For the Master of Science in Medicine, with distinction, Annika Chicken. For the Master of Science in Medicine, with distinction, Kirsten Welp. For the Master of Medical Science in Genetic Counseling, Sesetu Ntanjana. For the Master of Public Health with distinction in the dissertation, Shato Joy Khosi. For the Master of Science in Exercise and Sports Physio with distinction in the dissertation, Janine Ann Manchip. For the Master of Science in Audiology, Khafita Mustafa. For the Master of Science in Medicine with distinction, Kelly Cordum. For the Master of Science in Medicine, Chelsea Melissa Vogt. For the Master of Science in Medicine, Lisa Malan. For the Master of Public Health with distinction, Lissa Paul. For the Master of Public Health, Iman Kasim. For the Master of Science in Medicine with distinction, Anna Kuhar. Master of Public Health, Janice Lorraine Roda. For the Master of Medical Science in Genetic Counseling with distinction, Nolene Priscilla Chetty. For the Master of Public Health with distinction in the dissertation, Nancy Makamo. For the Master of Medical Science in Genetic Counseling with distinction in the dissertation, Samantha Lee Bailey. For the Master of Medical Science in Genetic Counseling, Nabila Pierbai. For the Master of Philosophy in Disability Studies, Priscilla Gregory Banda. For the Master of Philosophy in Emergency Medicine, with distinction in the dissertation, Ilunga Kamembela. For the Master of Philosophy in Pediatric Oncology, Lois Tafadzwa Chatwayo. For the Master of Science in Biomedical Engineering, with distinction, Annika MacArthur. For the Master of Medicine, Melissa Foster. For the Master of Public Health, Tasneem Essek. For the Master of Medicine, Nicholas Bradley Leach. For the Master of Science in Biomedical Engineering, with distinction, Vongani Cliff Lowen. For the Master of Science in Biomedical Engineering, with distinction in the dissertation, Joel Tabani Philpott. For the Master of Science in Biomedical Engineering, with distinction, Grant Gordon Sander. For the Master of Medicine, Tayanjana Cecilia Banda. For the Master of Science in Speech Language Pathology, with distinction, Samantha Carey Branfield. I do want to point out that distinctions are quite hard to come by in the faculty. Master of Science in Exercise and Sports Physiotherapy, with distinction in the dissertation, Krista Botma. For the Master of Science in Exercise and Sports Physiotherapy, Usra Ghani. For the Master of Science in Medicine, Jessica Chelsea Garlick. For the Master of Philosophy in Pediatric Neurology, Kwetoline Gwendolyn Kandawashika. For the Master of Medicine, Tracy Leanne Cook. For the Master of Medicine, with distinction in the dissertation, Lisa Clegg. For the Master of Science in Medicine, with distinction, Daniel Kotzer. For the Master of Philosophy with distinction in the dissertation, Zaineta Mehareen Maharaj. For the Master of Philosophy in Palliative Care, with distinction, Deline Murray. For the Master of Science in Physiotherapy, Sandra Banini. Master of Science in Medicine, Blessing Oluwapelumi Moses. For the Master of Science in Medicine, Reese Wilmore. For the Master of Science in Medicine with distinction, Christina Daniela Brazia. For the Master of Science in Medicine with distinction, Ligan Govender. For the Master of Science in Medicine, Marion Stone. For the Master of Science in Medicine, Cara Renee Golding. For the Master of Science in Medicine with distinction, Melissa Jane Thomas. For the Master of Public Health, Martha Chingwengwe. For the Master of Science in Medicine, Marina Fenter. For the Master of Science in Medicine, Peace Ogenerobo Francis. For the Master of Science in Exercise and Sports Physiotherapy, with distinction in the dissertation, Chanel Mouton. For the Master of Science in Medicine, Oganes Jasper Mbwambo. For the Master of Medicine, Hasina Bibi Sablé. For the Master of Public Health with distinction, Rufaro Blessings Tsodzai. For the Master of Medicine, Koshlin Dukoni. For the Master of Medicine, Fatih Abshina. Chancellor, I have the honor to present to you candidates for the award of the degree of Doctor of Philosophy. We recognize that they've reached the end of one journey, but we also put upon them the fact that they form part of an elite group in our society, and therefore we have many questions to ask them so that they answer them for us continuously. And so even as we engage in presenting these candidates, we recognize that this is a learning journey that is not of their own. Unless they're answering the questions of our society and engaging with the problems of our complex world, the PhD means nothing. And so today I recognize all of the work that has been done to get here, and particularly the work often done by families which goes unseen. And so I want to recognize the achievement of these PhDs, Chancellor. For the Doctor of Philosophy, for a thesis entitled Risk Factors Associated with Blood Pressure Variation in Sickle Cell Disease in Cameroon, Artemon Ngueneza. The Doctor of Philosophy for a thesis entitled The Genetics and Genomics of Rheumatic Heart Disease, Tafadzwa Diana Machipisa. For a thesis entitled, for the Doctor of Philosophy for a thesis entitled An Investigation of the Molecular Biomarkers Associated with Frontal Fibrosing Alopecia using Proteomics and Transcriptomics. Kutlwano Antoinette Molema. For the Doctor of Philosophy and a thesis entitled Designing a Functional Psoriatic 3D Model for Evaluation of Cape Floral Plant Extracts, Luveni Sonka. A Doctor of Philosophy for a thesis entitled The Development and Characterization of a heparinized fibrin hydrogel as a delivery vehicle for regenerative medicine. Silindile Ngobo. The Doctor of Philosophy for a thesis entitled The Economic Burden, Patients' Well-Being, and Social Determinants Related to Diabetes in South Africa. Asagid Getahun Helebo. For a Doctor of Philosophy and a thesis entitled Investigating the Multifaceted Host Contribution to COVID-19 Disease Risk, Progression, and Treatment, an integrative multi-omics network-based approach. Francis Edem Agama. A Doctor of Philosophy for a thesis entitled The Prevalence of Dysbeta lipoproteinemia in Ghanaian adults living in Accra. Richmond Owusu Ateko. For a thesis entitled, for the Doctor of Philosophy, Genomics of Sickle Cell Disease and Fetal Hemoglobin in African Populations, Kevin Eso Kum. The Doctor of Philosophy for a thesis entitled Marine-Derived Chromomycin A5, a novel strategy to treat TBX2-driven rhabdomyosarcoma. Mihlali Vuyo Mlazi. A Doctor of Philosophy for a thesis entitled Repurposing Drugs that Target the Oncogenic TBX3 to Treat Pancreatic Cancer. Karabo Serala. A Doctor of Philosophy for a thesis entitled Inoculating Individuals, Exposing Nations, Ebola Vaccine Trials and Global Health Research in West Africa. Marlon Colin Fora. Well done. For a Doctor of Philosophy and a thesis entitled Studying the Mechanobiology of Enveloped Viruses and Virus-like Particles and Their Interactions with the Host Cell, Elizabeth Cruz. For a thesis entitled Women's Empowerment, Fertility Interventions and Family Planning Practices in Mozambique, Sofia Tavares Castro Lopez. Somebody who's come through our clinician scientist track, Chancellor. Doctor of Philosophy for a thesis entitled Characterizing Various Aspects of the Male Genital Tract, Barrier Function, and Immunity, Cosnet Lerato Rametse. And I'm going to just boast a little bit that this is our chair of our Employment Equity Committee. The Doctor of Philosophy for a thesis entitled Characteristics and Outcomes of Children, Adolescents, and Young Adults on Antiretroviral Therapy in Southern Africa, incorporating additional outcome ascertainment through linkage and tracing studies. Patience Nyakato. For a thesis entitled Targeting Resequencing of a Large South African Cardiomyopathy Cohort, Polycarp Ndabingwi. A Doctor of Philosophy for a thesis entitled Mental Health and Cognitive, wait a little bit, you can hear your story. Mental health and cognitive outcomes associated with early childhood violence exposure, a focus on children in low middle income countries. Lucinda Panashe Tsunga. For a thesis entitled The Use of mHealth Active Participant-Centered Systems to Improve Surveillance of Adverse Events Following Immunization in Zimbabwe. Priscilla Patricia Munyaradzi Nyambayo. The Doctor of Philosophy for a thesis entitled Establishing In Vitro Models of Neuroinflammation to Investigate Neuroimmune Responses in Neurocysticercosis, Amalia Naita Awala. For a thesis entitled Correlates of Tuberculosis and Non-Tuberculosis Morbidity and Immunity in Sub-Saharan African HIV-exposed, uninfected infants, Sahari Iwase. For a thesis entitled The Effect of Bacterial Vaginosis on HIV Infection, Bianca Abrahams. For a Doctor of Philosophy for a thesis entitled An Investigation of Amygdala and Hippocampal Subregions and their relation to aging in anxiety and related disorders. Zipho Zihle Ntwatwa. For a thesis entitled Exploring the Influence of Romantic Relationships on Adolescent Boys' Sexual and Reproductive Health Attitudes and Practices, Tsidiso Hilda Tola. The Doctor of Philosophy for a thesis entitled Gendered Lives, Constrained Choice, and Young African Women's PrEP Uptake, that's pre-exposure prophylaxis, uptake and persistent use as a gender-responsive approach to HIV prevention, LZ Rousseau. For a thesis entitled Understanding Violence Within Protest, a case study investigation of the Rhodes Must Fall movement at the University of Cape Town, 2015 to 2016. Mapeyeledi Rachel Sibandlana. The Doctor of Philosophy for a thesis entitled Disease Population Genetic Simulation Framework Towards Application in Modeling Disease Risk Prediction and Heritability Rate, Jacqueline Wangui Mugo. For a thesis entitled Mechanisms of Atopic Dermatitis and Allergy Development in African AmaXhosa Children between 12 and 36 months of age, Nonhlanhla Lunjani. For a thesis entitled Assisted Partner Notification for HIV, a qualitative study of providers and female patients' perspectives and experiences of assisted partner notification in Cape Town, South Africa. Shahani Pereira. For a thesis entitled Computation Model of Thrombosis in Cerebral Aneurysms for Predicting Clotting Outcomes in Flow-Diverted Treated Patient-Derived Geometries validated with a novel PIV-based in vitro clotting flow experiment. Struan Robertson Hume. For a thesis entitled Investigating How the Learning Needs of Students with Vision Disability Are Understood and Accommodated Within Mainstream Secondary Schools in Cameroon, a case study of one secondary school. Bridget Ate Longlavobuzi. The Doctor of Philosophy for a thesis entitled The Role of Antibodies in Tuberculosis, Ashley John Jacobs. The Doctor of Philosophy for a thesis entitled A World of Possibilities, an exploration of experiences of children, just too quick, of children with disabilities participation in a surf therapy program in South Africa. So do it again. A world of possibilities, an exploration of experiences of children with disabilities participation in a surf therapy program in South Africa, Roxanne Jade Davis. The Doctor of Philosophy for a thesis entitled Comorbid Cardiometabolic Diseases Among People Living with HIV in Cameroon. Peter Vaines Cure Ebasone. For a thesis entitled Chlamydia trachomatis Diversity and Pathogenesis in Young South African Women related to HPV prevalence and risk. Pride Kanyoka. The Doctor of Philosophy for a thesis entitled A Novel Transcatheter Heart Valve System for Low to Middle Income Countries, Need Assessment, Surgical Feasibility, and Preclinical Translation, Jacques Sherman. For a thesis entitled Population Pharmacokinetic Modeling to Optimize Treatment for Children with Rifampicin-Resistant TB and HIV, Lovina Elizabeth van der Laan. For a thesis entitled Investigating Cell Mechanics of HIV-Associated Kaposi Sarcoma, Majahonke Ncebo Shabangu. For a thesis entitled Exploring a Relationship Between Shifts in High-Density Lipoprotein Particle Subclass Distribution or Functionality and Cardiac Function in doxorubicin-induced cardiotoxicity, Carmelita Bianca Abrams. The Doctor of Philosophy for a thesis entitled A Case Study of Factors Influencing Primary Health Care, Continuity of Care for Patients with Disabilities, Desandri Pariachi. For a thesis entitled Targeted Delivery of Exotoxin A and Granzyme B for Immunotherapy of Solid Tumors, Dennis Makafui Dogby. For a thesis entitled Investigating the T-cell specific role of interleukin-4 receptor alpha in tuberculosis, Robert Pierre Rousseau. For a thesis entitled Biomarkers and Cell Phenotypes in TB Patients with Minimal or Persisting Lung Inflammation Post-Anti-TB Treatment and ex vivo atorvastatin immunomodulatory effects on Mycobacterium tuberculous infected PBMC, Bongani Motaung. For a thesis entitled The Intersection of the HIV Epidemic and Blood Donation in South Africa, Karen van den Berg. For a Doctor of Philosophy for a thesis entitled How can the process of professional identity formation of a gender-affirming practitioner inform medical curriculum changes? Elsa Maria de Vries. For a thesis entitled The Regulation of the T-Box Transcription Factor, TBX3, in Luminal A breast cancer, Stephanie Maria Ngube. For a thesis entitled Formative Assessment of Weight Management and Lifestyle Factors in Overweight or Obese Patients attending the medical outpatient clinics at secondary hospitals in Ibadan, Nigeria, and feasibility testing of a weight loss intervention for the targeted population. Oluyemisi Folake Folashire. For a Doctor of Philosophy for a thesis entitled Pathways Through Opportunity Towards Social Inclusion, a multiple case study of young women in marginalizing context in post-apartheid South Africa, Liesl Peters. For a thesis entitled The Relationship Between Genes Associated with the Pain Pathways and the Development of Chronic Social Pain and Disability in South African Breast Cancer Survivors, Farzana Farfari. For a thesis entitled The Feasibility of Hearing Screening Programs in Primary Schools in Botswana, Mishek Muepeng. For a thesis entitled Investigating Kidney Disease Clinical Epidemiology Using Routinely Collected Administrative Data and Proteomics, Ryan Edward Aylward. I'm recognizing that I have to move faster, so it's all right. For the Doctor of Philosophy for a thesis entitled An Assessment of the Utilization of Stokvels and Rotating Savings and Credit Associations to Influence Healthy Eating in South Africa, Akim Tafadzwa Lukwa. The Doctor of Philosophy for a thesis entitled Early Lexical and Grammatical Development of Xitsonga Spoken in Giyani, Limpopo, using the adapted Xitsonga MacArthur Bates Communicative Development Inventory. Toddlers form a preliminary study. Mikateko Florence Ndambi.
Wow. Amazing. Can we give them a round of applause? This is the part that I like. Can you take your certificates, the paper, and wave it in the air? Okay. Watch this. The blue scrolls. Just pick them up, wave them in there. Love it. Love it. Ladies and gentlemen, this graduation ceremony is a pivotal milestone for both our graduates, as you have seen them, as well as for us at the University of Cape Town. For our esteemed graduates, this marks the culmination of years of hard work and the beginning of new opportunities. It's a moment of recognition, a moment of celebration, and it symbolizes your transition into the next phase of your life. For UCT, it is a proud affirmation of our mission to educate, to empower, and showcase the success of the programs, the work that we do, and the achievements of our graduates. This moment also strengthens the bond between the university and our graduates who now become alumni of UCT. They will carry with them the legacy of this prestigious institution of higher learning into the world. They will remain connected to UCT as alumni, and you will always be UCT. Let me take this opportunity to thank you, all of you, for this day, and congratulate you once again, graduates. Allow me now to invite our presiding officer, our Chancellor, Dr. Precious Moloi Motsepe, to take the podium.
Thank you very much, Vice Chancellor. It's been a pleasure working with you since you started at UCT. Thank you for joining us. It's really exciting. Graduations like this always make me very, very excited. As a parent of 3 boys who graduated themselves at various universities, I share in the jubilation of the parents as they watch their children, your loved ones, walking on stage. But as a former medical student in the same class as Professor, head of the medical faculty here, we were in the same class actually with Lionel. So this brings beautiful memories as well when I think back of our graduation in the 80s, Lionel. But what I've come to observe also over the last graduations that I've attended at UCT, it's really exciting, just watching the young people coming up on stage, coming to kneel before the Chancellor. I can tell which faculty it is by the way the students approach the step. The medicals, the health faculty, they're always very clinical. You can tell. The engineering students, they always try and rebuild that step. And the art students, they try and step outside that step and change it, think differently. It's really exciting to see the quality that comes out of this university. So our distinguished guests, our graduates, the proud families, this is truly a momentous occasion, not just for our graduates, but for the entire UCT community. It is time to celebrate our mission of advancing knowledge, fostering innovation, and contributing to the betterment of society. This day marks the beginning of a new chapter, one in which the knowledge, skills, and values that you have acquired at UCT will guide you as you step into the world. This achievement is a testament to your commitment to excellence and your readiness to take on the challenges and opportunities that lie ahead. Graduation is not just an individual accomplishment. It is also a shared success. It reflects the unwavering support of families and friends, the guidance and mentorship of our dedicated academic staff, and the relentless efforts of the professional and administrative staff who keep our university thriving. It is a day of pride and joy for the graduates and for everyone who has been part of this journey. As health science graduates, you have a unique and vital role to play in addressing the pressing health challenges of South Africa, Africa, and the world. From improving access to quality health care and combating the burden of diseases, to advancing public health initiatives and driving innovative research, your contribution will be essential. We challenge you to use your education to the betterment of society, to serve the betterment of society. Your degree is more than a qualification. It is a powerful tool of change. Whether you pursue careers in medicine, public health, research, or any other field, remember that your work has the potential to save lives, alleviate suffering, and promote the well-being across communities. We believe in your ability to rise to these challenges and be leaders in your field. As you embark on the next chapter, know that you carry the hopes and the expectations of your families, as well as the legacy of the University of Cape Town. We do not doubt that you will make us proud. Congratulations once again, and may your journey ahead be filled with purpose, impact, and success. Thank you.
Thank you, Chancellor, for those powerful words. We're very grateful for your presence gracing the ceremony and telling the Dean's secrets on stage. Now we know. Ladies and gentlemen, in a moment, I'm going to ask you to stand. But before I do, allow me to once again inform you that the procession is going to come out. I'm going to request the Chancellor shortly to dissolve the ceremony. And we will, I hope, have a moment outside to interact for everyone, the platform party and the graduates. And as we do, the graduates will be invited now to join the platform party as graduates. Thank you for the ceremony. Thank you for the wonderful session today. Congratulations to all of you, the graduates, families, relatives, teachers. We congratulate all of you. May I now request the presiding officer to dissolve the ceremony.
By virtue of the authority conferred upon me, I hereby dissolve this congregation of the University of Cape Town.